Now, one of the main disease risks is going to be malaria. This is carried by a tiny protozoa which is injected into the human from the female Anopheles mosquito. And she bites not because she has anything personal against you, but just because she needs a blood meal. Blood being very rich in a lot of proteins and a lot of energy sources that she needs in order to give her offspring the best chance of survival. Now, there are 4 different species, all carried under the family name of Plasmodium. The Vivax, Ovale and Malaria are known as the benign malarias, and these have been around for a long time and don't cause a lot of death but can cause severe illness. And then we have falciparum malaria. This is also known as cerebral and is responsible for a vast majority of the malaria associated deaths around the world. Now, just to give you an idea of how widespread it is, 40% of the world's population live in a malaria risk zone. That will result in somewhere between, and it depends on which books you're reading, somewhere between 300 to 500 million cases of malaria per year. Now, if you follow that down the line, that will in turn result in 1 million deaths every single year from malaria. Now, where are you going to find malaria? Generally speaking, Africa is far and above the worst area. Of those 1 million deaths, a vast majority will be in Africa, and a vast majority of those deaths will be infants and children. Other main areas that you'll find malaria will be across Asia, especially Southeast Asia, but also parts of Central Asia, across Central South America, and of those areas the worst is going to be around the Amazon. And some areas also to the east of the Mediterranean will have a small number of malaria cases per year. How are you going to know you've got malaria? Well, you're going to wake up feeling very ill. You may not be able to identify malaria immediately, but you'll know that there is something very seriously wrong very quickly. You'll wake up in the morning, you'll have the standard symptoms of very high fever, chills, shakes, extreme feelings of exhaustion. Perhaps you'll have a lot of muscular pain or joint pain, but generally you will know something is very seriously wrong quickly. What you need to do is notify someone that you are feeling unwell immediately. And the reason for this is because, especially if this is a falciparum malaria, this can progress very quickly from these severe symptoms through to coma or perhaps even death within 24 to 48 hours. So just remember, if you're feeling ill, get help as soon as possible. Now, I think the life cycle of the malaria parasite is very interesting. It comes in 2 very distinct stages. There's a human stage and a mosquito stage. Both are essential to the full life cycle, and the way it works is you get bitten by the female mosquito who's looking for a blood meal. Some of her saliva, which is carrying infective protozoa, comes into your blood, and within about 30 minutes those protozoa have found their way to your liver and infected a liver cell, where sometimes, if it's one of the benign malaria, as I mentioned earlier, it can stay for an extended period of time, almost, if you like, in suspended animation. Usually it will come out within a couple of months, but the benigns can stay there for anything up to a year plus. The falciparum type of malaria parasite will tend to come out much quicker, and often within 7 to 14 days it will have completed this particular part of its life cycle and will have moved on. Now, once they come out of that cell within your liver, they go through and they're in your blood looking for a red blood cell to infect, and each little protozoa as it comes out looks for a red blood cell. This is the asexual part of its reproductive life cycle, and once in a red blood cell it will over a period of time multiply until the red blood cell is ready to explode. The red blood cell explodes and releases many more of these protozoa into your blood. Each of those then go around looking for another red blood cell to infect, and the cycle continues and escalates cycle after cycle. And this is how the cycle progresses. Each time more and more parasites will be released from the red blood cells, very often on very specific time frames, and the symptoms will get worse and worse as the number of parasites in your blood increases. A very small number of the parasites, once they're released from that red blood cell, will move into the sexual cycle. This needs to be completed back into the mosquito, and obviously as a mosquito comes along looking for another blood meal, she'll suck up your blood, and at the same time she'll suck up some of these parasites. The parasites back into the mosquito, travel through the gut wall of the female mosquito, find their way into the salivary glands, continue to mature. When they're mature and the mosquito goes out looking for another blood meal, that's how another person, another human, will become infected. And you might find that one human will be infected by several different types of malaria, sometimes from the same mosquito or sometimes from different mosquitoes. That's the life cycle. Now, how do you avoid becoming ill? The best way is not to get bitten. If you don't get bitten, you cannot catch not only malaria, but any other type of mosquito-borne disease. There's no 100% way of avoiding getting bitten, but I think we cover in a different part of the CD all the best ways. I'll just reiterate very quickly. You cover up. If you reduce the amount of skin that you have available to the mosquito, then reduce the number of bites. Baggy clothing will often help because they may try and bite you through the clothes but can't actually reach you through the gap between the clothes and your skin. You can also treat your clothes with permethrin or other products that will actually kill the mosquitoes as soon as they land on your clothes while they're looking or deciding what part of you to take a bite of. Insect repellents, very, very important. I think we've covered bite avoidance in much more detail elsewhere, but 50% DEET or a good high percentage DEET product will offer the best insect repellent action. Antimalarials will also be very important because you can't reduce the number of bites you get to zero. You will still always be bitten. Antimalarials will provide a very, very high level of protection. Generally this will be never any higher than 95–98%, but a good combination of antimalarial prophylaxis plus bite avoidance can offer almost total protection against malaria. Antimalarials, different shapes and sizes, different prices, and depending on where you're going and the species and the types of mosquitoes, the types of parasite that are present, different antimalarials will be recommended. It's also very often a personal choice and a personal recommendation that will be made to you based on your personal medical history, your family medical history, whether you've taken antimalarials before, the different area of the world that you're travelling to, and also budget. And having sat you down, discussed all the pros and cons of each different type of suitable antimalarial, because remember, not all antimalarials are suitable for all areas, but having maybe got a choice of suitable antimalarials, it's very often a personal choice for you to make as to which one you want to go for. And like I said, you will need to speak to either your GP or come and chat to someone like us, travel health professionals here at Nomad. Now, I said that no antimalarials 100%, I said no bite avoidance is 100%. There is still a possibility that you are going to catch malaria. Now, I've said signs and symptoms to look out for, and again I will reiterate how important it is that if you do wake up with the exhaustion, the fevers, the chills, the aches, the pains, that you do notify someone quickly and attempt to get good treatment, effective treatment, as rapidly as possible. Now, once you get to a hospital, they can actually make a diagnosis of malaria very, very quickly. A good trained technician, quick blood tests, and they will come back and tell you whether you've got malaria, and with a bit of luck also what type of malaria you've got and what type of treatments they're recommending at that time in that particular area that you're in, and hopefully the treatment will be completed very, very quickly. Now, if you think before you go you are going to find yourself in a very, very remote area where good access to medical care is just not going to be available, something that you can do is take a treatment with you. Now, the WHO, World Health Organization, recommended treatment now is Artemisia. This in the UK is available in a combination with another drug, but it's available as a product called Riamet. Now, it's very, very difficult to truly diagnose whether you do have malaria, and the self-diagnosis kits can be very difficult to use because of the symptoms. If you think you've got chills, severe shakes, it's going to be very difficult to to run a minor chemical experiment, if you like, to identify accurately whether you've got malaria. But what you can do is you can start treating immediately once you have these signs and symptoms with the Rheomet, and start making your way to hospital where they can make a definitive diagnosis and decide whether or not the treatment that you've got is actually going to be correct.